wind up on the topics, we definitely have to touch to a personal experience.
Yes.
So anal fissures and hemorrhoids.
Yeah.
And, just layman's terms again,
Yeah.
if you're to describe these two,
Yeah.
how would you describe them to a layman's?
Actually, there are three things which affects an anus. So,
Okay. What's cyanosis?
No, fistulas.
Okay.
Fistulas, and hemorrhoids. There are three things which affect
Fissures,
fistulas, and hemorrhoids.
Okay.
There are three things that affects anus. All three comes because of constipation. Okay. So a fissure is a cut at your anus, which happens because of hard stools, and that cut typically gives a lot of pain and minimal bleeding. Okay. Fistula is an abnormal communication between your anus and the external skin. So it creates a small track between these two things, and it gives you pus discharge around your anus. And hemorrhoids are the dilated or maybe swollen blood vessels inside your anus, which typically gives you bleeding but minimal pain. So these are the three things. More pain, less bleeding, it's a fissure. More bleeding, less pain, it's an hemorrhoid. And pus, it's usually a fistula. But basic cause for all these three things is our lifestyle and constipation. So if you don't drink enough water, if you don't eat enough fibers, and if you're not active enough, if you have sedentary lifestyles, you may get these things. There are some other medical conditions also, like for constipations, like if you have thyroid issue, diabetes issues, some electrolyte abnormalities, you can still get constipation. But the most common causes is our diet and lifestyle.
Okay, and then this is just me throwing it out there and just asking randomly, as a layman. Is there any way that this could be like just affected on someone because of like maybe genetics, or it just comes naturally? Are there chances that can just happen naturally, or like maybe genetics, or
see, there is no evidence that it's genetic. Okay. But why you see more common in a families, usually families will eat same diet. So when you guys are eating same things, more people in a family can get the same things. But exactly, it's not a genetic thing.
Okay. So most likely, definitely food and lifestyle.
Yes.
And then like a follow-up question on that, would that mean that if somebody is doing like an 8 to 5 job where they're seated on their desk probably, which is like a huge population of people who normally check in 8 in the morning and they sat on the desk probably till evening.
Yes.
Can that be like also like a major?
Yeah, that can be a major issue. But see, again, it's your choices. You're still having time from 5 to 8 in the morning. You can be active in that time.
True.
You can have enough fibers during that time. But yeah, it's not advisable to sit continuously 8 to 5 on desk. Even if you're working, you can obviously stand a bit, have a short walk for maybe 1 or 2 minutes every 15-20 minutes and come back to your chair. I don't think any supervisor wouldn't allow you that. You can just have a small walk for 1 or 2 minutes every 15-20 minutes, and which should also help. If you stay stationary for very long, then it will definitely affect you.
The main reason like I've brought this up also, it's because I'm just trying to think like in normal circumstances, if somebody's like in primary school, it does involve you like sitting down for like a very long durations of time.
Yes.
High school, probably the same. And then you get into the job market. Also again, like, yes, you can take like a few minutes to exercise, but I think once you get past like high school, probably people slow down on like exercising a lot and putting into consideration things like fiber, hydrating.
Yes.
Actually, and even to mention on that, I remember like when I did my Euro trip, I remember there's this lady who kept on getting headaches. And then I kept on telling her, like, I don't think I've seen you drinking water like the entire trip. And she just said she's not a fan of water. And basically she says, I asked her, if you're thirsty, what do you do? She said she drinks soda.
I would say it's a poor choice. I mean, water is the best drink, I would say. Soda brings along a lot of carbon dioxide, acids, and a lot of sugar. So this high sugar and no fibers at all. So it's not going to help you. So eventually you end up having these headaches and other things like gastrointestinal disturbances, obesity.
And long term, it's just not good.
Yeah, not at all.
Okay, and then like when is surgery necessary for just the fissure, fistula, and hemorrhoids? Like when do you think like now is like okay the perfect time to not the perfect time, like the necessary time to get it, because maybe you're trying your remedies and everything.
Yeah, so fissure and hemorrhoids, they can always be treated with diet and medicines as well. So we usually start with dietary changes, drink more water, eat more fibers, all these things. There are medications to treat fissure and hemorrhoids. When the medications also fail for approximately if you have tried medicines for 4 to 6 weeks and still not helping at all, or in case of fissure, the pain is excruciating that you can't even tolerate to sit. Those cases, you obviously need to go for surgery. So that's the thing. For fistula, surgery is almost always needed because it's a track. It's an anatomical defect which doesn't close by itself with any medication. So fistula, almost always you need a surgery. But fissure and hemorrhoids, we do it when medical management fails.
Okay, and then like just things like hemorrhoids and also let's say fissure. Is there any chance they can just go away on their own? Like let's just start maybe with hemorrhoids because they are more, how would you say it? Like the things that have grown like kind of like, is there any chance that they can go away?
Like fissure can go away by itself if you take care of your diet. Fissure is a cut. A cut can heal and it will go away. Okay, but it can always come back again if you are not careful with your diet. Okay, hemorrhoids, early stages. If you start taking care of your diet, take some medicines, it can go away at early stages. But if it's intermediate or late stages, less likely to go away completely. But as long as they don't give you any bleeding, you can just let it be. Not all the hemorrhoids needs to be operated unless they are giving you any symptoms.
Okay.
So that's fine. Fistula, they never go away by its own.
Oh, so that just definitely needs a procedure. Okay. Why do you think many people delay treatment for rectal issues? And what would you say for someone feeling embarrassed to seek help? That's definitely me, first of all.
First thing is embarrassment. You are shy away to talk about private parts, anal parts. So you wouldn't even tell anyone. That's why people come to doctors very late, especially females. Because if you see, still, the majority of doctors are male. I mean, we do need more female doctors. But when you're a female and if you have to go to a male doctor, you won't be comfortable to get examined like that. So that embarrassment is the major cause that people delay their treatment. After the treatment also, there is more fear getting cut at your anal area. You'll always have more fear to get a cut. I mean, rather than having a cut you'll prefer a cut on a hand over the anal area. So because of all these things, because there is a cultural taboo with that area, and that makes people delay their treatment.
Okay. Now, in this one, you can, if you can talk about it, I don't know, because I don't know, like, doctor-patient, what is it called? Doctor-patient...
relationship, confidentiality.
Confidentiality, right? Like, just from your own medical perspective, like, what stood out, like, in my own case? Because even for now, I know I'm better, definitely, but I would want to know, like, probably, like, what stood out or, like, what really was my big issue.
First thing I like the most, which stood out most, is you're happy to talk about it in front of camera. Definitely. You have not shied away.
Definitely.
And you're encouraging people not to shy and seek help as soon as possible so that you can have better quality of your life. So that's the most important thing for me. Which I like the most.
I appreciate that. Okay, now, and just like now for my personal procedure, like I thought I had fissure, but also like in your notes, it said like there were hemorrhoid findings, right? So is it possible, like maybe just to explain to that again, because there are so many people, it's crazy because after I was just doing my post-care, people are trying to visit me, and just like usual, friends pass by. I'm like, no, this is not the perfect time because I'm healing. I just had surgery. And then once I start describing what one person knows somebody who's going through something similar, and so on and so forth. But like from my personal procedure, like what exactly was going on with my situation?
Now, see, that's what I told you. First thing, when you have a fissure, because of your pain, your anus is tight. I mean, you tighten your muscles out of your pain. So I can't see deep enough before surgery. So all we see is a fissure, and that was the major problem. So we scheduled you surgery for a fissure. During the surgery, under anesthesia, I can see things better inside. So we found some hemorrhoids. But as I just told you, not all the hemorrhoids need surgery. It was not giving you any bleeding. So unless it gives you a problem, you don't need to touch it. And you don't do unnecessary procedures. So you only treat what's giving you problem right now. If it's something which in long run can be harmful, like it can turn into cancer, we need to take care of it. But these things don't turn into those things. And it can be managed with diet and lifestyle. And you are very much positive about making changes in your diet and lifestyle. So we don't need to touch it. So that's why we just mention it, that it is there. But it doesn't need to be done right now.
But that's not like nothing major that's affecting me.
What was affecting is a fissure. So we take care of it that time.
Okay, and then now like another thing, because I can say now that I think about it, this is probably something that has been on and off. If I was to think like an accurate number of just duration of months, years, I can say probably maybe 8 years.
8 years, that's a long time.
Yes, but now again, there's a fear of talking about it, like, and not understanding exactly what's going on, and not knowing who to go and talk to, or even if you go to hospital, I think like it's not easy if you're going to a specialist where you know exactly what's going on with you.
That's true.
So like from your perspective, how do you think my procedure went?
It went pretty smooth. Like by the time you came, you were very much predetermined that you want a permanent solution because you had suffered for a very long
time.
So it didn't took a lot of effort to explain you the requirement of surgery. You were well prepared. During surgery also, you were very positive. So it helps us a lot. Usually you see when a patient is anxious, it also creates some difficulties, but you were well prepared, not very anxious. You were a bit positive. So that's what I liked a lot. I mean, and that's what I want to tell all the patients, that if you stay positive, that trust in your caregiver, trust your doctor, trust your nurses, be positive and think about positive outcomes. It definitely helps. Okay, it's kind of like a law of attraction, that if you think about negative things a lot, you may get some of them.
That's true.
That's why it's not like that if you think about positive things only, still you can get some negative things sometime.
True.
But that doesn't mean that you need to stay negative. Always try to stay positive. We are always well prepared. If anything goes wrong, we are trained to manage it as well. And we always explain all the things, possible complications before surgery. And that is done to relieve your stress rather than increasing your stress.
True, very true.
So the positive attitude is very important.
Okay, like what advice do you have for patients, probably like me or other people who are just navigating post-surgery healing?
Post-surgery healing, being ambulatory is the most important. Try to be as normal as possible.
Okay.
Don't stay in the bed and feel like a patient. Try to feel like a normal person. Get out of bed, walk a bit. I'm not asking to run or go to gym, but move around in your house. Don't have fear of eating the healthy small stuff, because I've seen that people are having fear to going to toilet as well, and that's why they don't even eat that. If I eat, I'll have to go to to toilet. So I've seen that as well. So don't have fear. Try to be as normal as possible. Take your medicines regularly. Follow the diet advices, and it all should be fine.
Okay. I know for my case, I can just say definitely the first week was like the most difficult, but it's just because, it's still probably the wound is still fresh.
Yeah.
And it's kind of like still in the process of healing.
Yeah.
But definitely it gets better by week 2, week 3,
Yeah.
week 4. It just like there's a very big improvement. And also like just quality of life definitely changes. And I can't believe like just, from like 7 years ago, probably I've been experiencing the same thing. And now it's no longer there. That's just to me mind blowing, because it just shows you like the importance of how modern medicine can actually just change your quality of life and actually just even save you from like, further pain, discomfort, like in future.
That's good.
Okay, another thing that I have to ask on just fissure recovery. What's the importance of like sit baths routine?
Yeah. Now, sitz baths are helpful even before surgery and even after surgery as well.
Okay.
The basic purpose of sit bath is give you some relaxation in the muscles around your anus. Now, when you have a cut at your anus, due to the natural reflex of to that cut, the muscles around anus goes into spasm.
Yeah.
And your anus becomes tight. So it's same with surgery. Although we make a cut in the muscles in that area, but when you do sitz bath, it always relaxes the muscles and soothes the healing process. That's why sitz baths are necessary.
And then I don't know how maybe you can explain this, because again, to me, it's just like as a patient, again, like I'm quite away on my notes, but I'm trying to make sure we just end on time and we're almost there. Like, how is it that you're not in control? Because when, let's say you're going for bowel movement or you're going to the toilet, like automatically, like just your anus just locks up on its own. It's not even you.
Yeah.
You're trying probably to go, but you find it like just closing up automatically. What's just the major?
Is it before surgery or after you're talking about?
Oh, no. This is before.
Before. Yeah. As I told you, it's the reflex to the cut. When you have a cut, in response to the cut, the muscles goes.
Also, it's just the muscles on their own. They're just tightening.
Now you see, we have two kinds of muscles around your anus: inner muscles, outer muscles.
Yeah.
The inner muscles are involuntary muscles. You don't have control over them. Outer muscles are voluntary muscles, so you have control over them. So normally, the inner muscle involuntary can become tight and can relax depending upon when the stool reaches into your rectum. Okay, but when you have that cut, because of those spasms, it doesn't get relaxed. Even if you try to relax your external muscles, that internal muscle is still tight because of the cut.
Oh, man. Okay. And then another thing also, as we're winding up, just because I've noticed, like when I've started talking about like, I got this procedure done, I got this procedure done. Like I've heard like people say, like, I know like people who are there in their early 20s, and then there's a friend of mine who said like they have like a cousin who's probably in primary school, and they're experiencing something similar. Because to me, when they were saying like constipation, I'm just like, okay, does the person fear going to the toilet? Is there pain? Now I start like analyzing as a doctor, because I'm like, I think that's exactly what I was going through. But what do you think is the main cause, like even in younger people having something like this? Because I've noticed
partially fast food. It has increased in recent years, and kids eat more fast food. They don't get enough of fibers out of these fast foods. Another thing is children are very playful. They'll play a lot and forget to drink their water. So because of that, they go out playing. They totally forget they need to drink their water, and those are the factors which affect the kids.
And at this point, I think like even if I was to have a kid, like they have to drink water, whether they like it or not. It's just some of the things that you have to like just create a certain lifestyle and make sure people just. And I think even from everything that we've talked about, it all narrows down to lifestyle and diet.